Hey, do you know what time it is? Oh, that's right. It's plastic surgery time. Dr. Amjad from Amjad Plastics to talk to you today about positional plagiocephaly here in our beautiful location, but back to reality. Now that we're back in the office, let's talk about plagiocephaly. Either you or your pediatrician have noticed that your baby's head shape may not be perfectly round. There's a concern. They've told you to go see someone. You've either seen a cranial technology or other facility which has done some type of measurement of your baby's head, or you've seen a craniofacial plastic surgeon. So what are we worried about and what are we talking about? Well, plagiocephaly is rather common. When the Academy of Pediatrics told everyone to place their baby on their back to decrease the incidence of sudden infant death syndrome. Sudden infant death syndrome was occurring when babies were placed on their stomach. So now placing them on their back to sleep improved this, but came up with some other issues, which are all treatable. With this, we've noticed that babies, when they're laying on their back for a prolonged period of time, will flatten out parts of their head. Some studies say about 50% of babies will have some effect of plagiocephaly, and that 1 in 10 will require treatment. Plagiocephaly is flatness caused by laying on one spot of the head for too long. Babies' heads are soft, and because they're soft, when they lay flat on a surface, they mold. We'll talk more about this later with our baby Hermie. Now, as an adult, you move a lot more and spend a lot less time sleeping than a baby. With that soft skull, the brain wants to be a circle. But if it's planted in one position for too long, that area flattens out, allowing the head to get a strange shape. All correctable with time, helmets, positioning, and neck stretching, unless there's torticollis. Torticollis is a tightness of the neck. In that case, this has to be treated with significant therapy or surgery sometimes. In the following examples, we'll go a little bit more in depth about plagiocephaly. So in this first example, we can see the baby with an area of flatness. That area of flatness, which is the baby's right hand side, is where the baby likes to lay down. So if it's on the baby's right hand side and it's right posterior flatness, the baby's turning the head to the right and laying down on that right hand side. So you see that area flat. The right forehead will bulge. And this is how we know that this is positional plagiocephaly. And you can see other parts of the head that show the bulging and the flatness, all corresponding to this. In the next image, you see plagiocephaly with a little bit of turicephaly. But this is a significant example showing you how the head shape can change, with this tightness in the back causing a height of the head to raise and also a flatness, which are all obvious in this situation. So the next question you're asking yourself is brain development. Will my baby have a normal brain? With positional plagiocephaly, there is minimal to no risk of having any type of brain development which is abnormal besides other issues which the baby may have, for example, autism, etc. But otherwise, profound mental delays do not occur with isolated positional plagiocephaly. These occur with craniosynostosis, and usually multiple sutures. Craniosynostosis is when the skull, which we all know that soft spot, closes too early and doesn't allow brain growth. That locking in of the brain and not allowing it to grow can cause these issues. Also, many of these patients will have syndromes where they have other medical problems, and in that case, there is an issue with brain development, intelligence, and delay. If you're watching this video, it may be a little too late to talk about prevention, but prevention is allowing your baby to turn its neck from side to side, spend more tummy time, more time sitting up, and basically staying off the back, and staying off the back of the head. Now, prevention goes into treatment. If we do those things, this will improve over time. Also, making sure the neck is loose. That can be occupational or physical therapy or home stretching. All of these things can be done and should be done. Plagiocephaly, if caught early, can be treated without the use of the helmet. If there is severe torticollis or we're late, helmet therapy is an appropriate option. And here's a helmet. But to talk to you more about helmets, here's Baby Herman. Take it away. All right, so we're going to fill our baby, I don't know what we're going to call our baby, Baby Herman, with water. We're going to get his head up in order and then I'm going to show you what we're going to do. Happy baby. All right, time to get Baby Herman into his helmet. This is going to be exciting. Baby Herman is already not happy about going in his helmet. See, he's like, no, I don't like my helmet. Don't do it, mommy. When this explodes all over me, it's going to really suck. Oh, no, it didn't explode. Hi, mommy. Ready to go to the mall with his new helmet. Okay, so Baby Herman's now in his helmet. This side is flat, and this side was normal. This side was bulging. So when he goes into the helmet, you can just see it keeps the head with normal pressure everywhere. And even if Baby Herman likes to roll down onto his left side, he's going to stay nice and round. Okay, and that's the key. The helmet is preventing the table from pushing on that skull of his and creating a deformational change. So as you can see, Baby Herman turned his helmet around and does not have it on the right way. Please make sure your baby doesn't put their helmet on this way. But Baby Herman did want to talk to you and tell you thanks for watching the video. He hopes you understand a little more about plagiocephaly. And of course he wanted to tell you, what did you want to say, Baby Herman? Watch and like and subscribe and do all that cool stuff. Thank you.